Hello, today is November 13th, 2020. My name is Alyssa Rodriguez and I'm interviewing Esme Campos for the University Library Special Collections and Archives at the University of Texas, Rio Grande Valley. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Campos, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voices Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documents that you are willing to share. UTRGV University Library will retain copyright or non-exclusive rights to the interview and other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voices Oral History Center at the University of Texas at Austin for inclusion in the Voices of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
As you recall, we previously filled out a pre-interview form. We used information from the pre-interview form to help in research. The entire form is kept in a secure Voices server at the University of Texas at Austin. Before Voices sends it to UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members. So that will not be a part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
Yes, I agree.
On occasion, UTRGV Special Collections and Archives and Voices receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you have to say in the interview questions that I will now ask. So, Esme, thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives and the Voices Project, particularly for us at the UTRGV Special Collections. And we are committed to preserving the stories of Mexican Americans and Latinos from South Texas and the Rio Grande Valley, and those who work closely with these populations during this COVID-19 pandemic. Because you can share how COVID altered your place of work at a county appraisal office, because you are a survivor of COVID-19, and because you are a daughter, sister, mother, and friend who is knowledgeable of the ways COVID-19 has affected others in your circle, I know you have many meaningful stories and experiences to share on how COVID-19 has impacted these roles that you carry out in your life. So before I ask you to share stories about your life in this pandemic, please tell us, who is Esme Campos?
Hi, so I am a 39-year-old mother, daughter, and friend. I spend most of my time with my family and my friends. That's pretty much me.
So the first question I want to ask you is, when did you first hear about COVID-19? How did you learn about it? Did you hear it in a radio, the TV, social media?
I think I first heard about COVID probably back in December of 2019, just through news medias. I remember seeing it on the news, everything that was happening in China. It just, it seemed just very surreal, but that's probably about the time that I remember hearing it, probably about December of last year.
What was your first reaction to the information about COVID-19?
It was all really confusing, to be honest. We really didn't know a lot about COVID or how it was spread or anything about it. So I was just very confused and scared. Just seeing everything that was going on in China, I was just scared. That was just my biggest reaction, was scared of the unknown.
So at what point did you realize that this pandemic was a serious life-altering event, or do you still think that it's not serious?
I most definitely think that it is a serious life-altering event. I think the first time it really hit me was when I started seeing the reports of New York, seeing the freezer or refrigerated trailers being used as morgues, and the nurses that were being flown into the city of New York. Just nonstop reports of cases after cases in New York was just so surreal. That was when I first realized, oh my gosh, like it's here. This is a reality for us now.
Over the last few months, what news media, social media, or other sources do you rely on to keep you informed about the coronavirus?
I think I use a lot of basically anything that's on the internet. Any of the news outlets, Yahoo, MSN, anything that's on the internet as far as news wise. Of course, Facebook, also any articles that would pop up are the outlets that I would learn about Corona.
And do you constantly look at these news outlets?
At first, I really tried to keep up to date. And I was just constantly like looking for it and researching and wanting to know everything about this unknown virus that had come into our lives. And that was the only thing that I could think about. But it also got really scary because it absorbed like my entire life. And all I wanted to do was just know more and know more. And the more that I read about it and the more that I researched it scared me. But I just wanted to be educated in what this virus was and the reality of what was our new life.
So can you share with me what you understand about COVID-19 as an infectious disease?
From what I understand, it's a respiratory infection. It hits you hard in your respiratory areas. From there, anybody with underlying health conditions are at risk because once it hits your respiratory areas, it affects your blood pressure, it affects your heart, it affects any autoimmune disorders. So just because it starts with your lungs doesn't mean that that's the only thing that it affects. From there, it's just a breakdown of every other part of your body, from your lungs to your heart to your blood to your liver. I mean, it slowly eats away at every other part of your body. So even though it may start as a respiratory virus, it just spreads to everything else.
So likewise to that response, can you share with me what you don't understand about the new coronavirus?
I think for myself, there's just so many conflicting stories or so many conflicting reports as to the true nature of how this virus is spread. Is it airborne? Can you get it through surfaces? I think for me, that's just the biggest thing. If I take my mask off for a few minutes and I'm talking to somebody, am I going to get it? Am I going to get it if I touch the shopping cart at Walmart and then touch my face? I mean, there's just so many things that people say, but this virus just is so new and so different that they're still learning so much about it that I don't know. My biggest confusion is how exactly does it spread and how can I protect myself and my loved ones?
So would you take the first COVID-19 vaccine available on the market?
I've thought about that, and I think that I would. I would definitely take one of the first vaccines that's out there and available to non-essential people.
And why is that?
Well, being somebody that has had it and somebody who lives with people who are high risk, um, I would like to say that I trust the FDA and the people who are telling me that it's safe to take and safe to, it's not a cure, but it's going to help prevent deaths. It doesn't mean you're not going to get it. It doesn't mean that it's not going to be difficult, but if it can prevent you from getting it to the extreme point of being put on a ventilator or being put on a point where you have to be hospitalized, I would definitely do whatever I can to keep myself and my family from getting to that point.
So if the FDA were to approve it and say that it is beneficial to your health, you would take it?
Absolutely, I would take it, yes.
And if, let's say, President Trump were to say, take this, would you take it?
Not, I would not, because there's always hidden agendas, I think, when it's, not to get into politics, but when people in certain positions might have agendas to try to push either direction. Take it, don't take it. I think if it comes from a source that has no ulterior motives, that doesn't benefit either way from telling you that it's safe or not, I would rather take that aspect of it and trust somebody who doesn't have or would not have any agenda or any benefits from people taking this vaccine.
So do your family hold the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly?
For the most part, my extended family, we all kind of feel the same way. The household that I live in, we obviously most definitely all feel the same way. I have a sister who has an autoimmune disorder, so she clearly feels extremely the same way about us. With that being said, I do have a brother who doesn't have any high risk people in his family. So while myself and my parents and my sister tend to keep to our little bubble and stay very self-quarantining for our own purposes, he tends to branch out a little bit more, sports for the kids, things like that, because we don't see them, and because they choose to do their activities outside of the home, we tend to stay away from them, and that's just their choice. But they still feel that they need to take precautions, but not as much precautions as people like us who have high risk family members in our house.
So for this next set of questions, I'd like to talk to you about your experience with COVID-19, since you are of risk while having high blood pressure, and how this virus affected you and your body both mentally and physically. So my first question is, can you share with me your story of when you first began to feel sick? What kind of symptoms did you have?
The first symptoms that I had were fatigue, extreme fatigue, and cough. I think it started, basically I would get out of work at about 5 o'clock, and I would come home and I just felt exhausted, and I felt so tired, and my bones felt like lead, and I would come home from work and I would want to go straight to bed, which was not something that was normal for me. I didn't even want to have dinner. And I didn't feel sick. I didn't have fever. I didn't have any other symptoms. I just felt extremely tired. And I just thought, oh, it was a hard day at work. I'm just tired because I'm stressed out. It's just been busy at work and I've got a lot of things going on. I was just tired. There's no way to explain the lethargic feeling that I had, and just the heavy, like, bones feeling that I had.
Did you express to anybody the kinds of symptoms that you were having?
I did. I live with my parents, so I did mention to them, I'm just tired. I'm just tired. But I really didn't think anything of it. I just said, I'm tired. I'm tired. I'm going to go to bed. I'm tired. I'm going to go lay down. I knew that that was a symptom of COVID, but it really didn't occur to me to think, oh, I might have COVID. I just felt, I mean, it's a long day at work, I'm tired, and I just want to take a nap. I didn't think anything of it, but nobody in my family really said anything. They just said, okay, you're tired, get some rest. And that was it.
So did you do research to see if your symptoms were of COVID-19?
I didn't at first. I kind of already knew a lot of the symptoms of COVID. I think I got concerned when two of my coworkers were diagnosed positive for COVID. And then I started to kind of put things together, such as what I was feeling, and knowing that I had coworkers who tested positive. I thought, could this be COVID?
So how did you react? Did you call your doctor or did you try to wait it out?
Well, the first thing I actually did was contact my human resources person at work, and I told them I'm starting to feel lethargic. I'm starting to feel tired. I know those are COVID symptoms. We do have 2 employees that are out currently for COVID. What should I do? I didn't contact my doctor first. I contacted HR and they said, get tested. So as soon as I hung up the phone with them, I started looking into where I could go to get tested.
So how did you schedule an appointment for testing? Was it difficult?
It was very difficult. It was very, very difficult. The first thing I did was contact my family doctor. And unfortunately, they told me at this time they were not testing. It was at a point where testing was not so easy to find as it is now. And I had to call around several doctor's offices, several clinics, several places. I was able to find a clinic in a city probably about 40 minutes away from where I live. And they were able to test me, but it was on a drive-up basis, and you had to just wait in line and hope that the cutoff wasn't met before you were next.
So where exactly did you go? It was like, was there just tents? It was a clinic?
I went to a clinic and they told me that the testing was going to start at about 8:00 a.m. and it would be best if I showed up 2 to 3 hours early because the line was starting at that time and there was only so many tests that they were doing per day. So once they reached that max testing, even if you were in line for 2 hours, then you're out of luck and then you would have to come back the next day. So I woke up at 4 in.the.morning and by myself drove to a city about 40 minutes away and got in line at 5 in.the.morning. I was parked in an alley, to be honest. It was in the alley behind a clinic. And I was scared because I was by myself. I was scared because I was by myself because I thought I might have COVID, because I was afraid to fall asleep in the car and miss the testing. So basically what I did is I set a timer for every 30 minutes to make sure I didn't fall asleep. And I lowered the window a crack enough to let air in the car because I turned the car off. And I watched a little bit of TV shows on my phone. I slept 30 minutes at a time. And I was there from 5:00 till 8:00 waiting in my car to get tested.
Did you have to pay for the testing?
I did. My insurance covered the nasal swab. I only had to pay the copay for that, which was a $25 copay. But I also wanted to do the blood antibody testing. And that one I had to pay cash, and that was $125 for that.
So can you share with me what you were thinking as you arrived to get tested and was waiting in the parking lot, surrounded by cars in an alley?
Honestly, a million things were running through my head. I was like, is this really happening to me? It never feels real until it happens to you. And I was in shock because I thought I was being safe. I was taking precautions. I was wearing a mask. I was washing my hands, using hand sanitizer. Like, how am I here right now? How am I in this position to get tested where I didn't think that I could possibly be sick? And am I sick? oh my God, what if I am sick? What am I going to do? My parents, my daughter, I was just a million things were running through my head about what would happen if I was positive. I mean, it was a very, very scary moment to be in.
How did it feel? Was it painful being tested, like the swab, the blood, everything?
Um, the swab testing was painful. I guess I've taken it a few times. So I think the first time I took it was probably the least painful. I don't know, some of the people who do them maybe go a little further up your nasal cavity than others. It wasn't that bad. It was just the anxiety that I had for the test. The anxiety was just out, insane amount of anxiety. And then I did the blood test, was just a little prick of the finger, which wasn't that bad.
So, like seeing everybody in their PPE, was that surreal? It didn't feel real?
It's honestly, it was like something out of a movie where you see these people in this like hooded outfits where they're contagious diseases. And it was just, I tried my best to be mindful of not getting them sick. So anytime they came to my window, I would lower the window and I would put on my mask to talk to them, because these people are also putting their lives at risk to come and test all of us. But it was very surreal. It was straight out of a movie, just car after car after car with these people with these entire like hooded outfits that I had never in my life seen before other than a movie. It was just nothing that I ever thought I would have to experience.
Did you pay for rapid testing?
I did. I had to pay for it, $125 for the rapid testing. And I got my results in 15 minutes. And it told me that I was positive for the antibody, which was a little deceiving for me, to be honest, because the only thing the doctor could tell me was that I had the COVID-19 antibody in my blood. That doesn't tell me if I had COVID-19 at that moment. So I was a little confused. I didn't really understand. Do I have COVID? Do I not have COVID? And I would not know until I had the results from the nasal swab.
So how long did you have to wait for the results of your test? And while you were waiting, did you have any feelings of anxiousness?
I had to wait an excruciating 10 days from the day that I got tested to find out that I was positive for COVID. Even though I had a positive for the antibody, the doctor said that it could be that I had COVID in the past or I currently had COVID. So I was still praying that it was allergies and I was just tired from work and that I did not currently have COVID. However, that was not the case.
So how did your family feel when you told them that you wanted to get tested?
They urged me to get tested. Once I told them my coworkers had it and I was feeling tired and I had a cough, and they said, better be safe than sorry. I think we were all kind of in denial or hopefulness that it wasn't true, and we thought it was allergies. And for the first few days, we thought it's allergies. She's fine, it's allergies. Because we didn't want it to be true. At that point, I didn't know anybody who had COVID. So it was scary, and we just were hoping that it was not true.
So you're saying that you hadn't known anybody that had COVID, but you had explained to me that your coworkers had COVID. Were you close to them, or were they just coworkers that you would see at work?
One of them was my immediate supervisor, and another one, I dealt with her on a daily basis. And the other one was administration. And what I mean by I didn't know anybody that had it before was they were the only persons that within this time, like that time period, I didn't know anybody who had it and been intubated, or anybody who had it and had symptoms. They got diagnosed 1 or 2 days before me. So at that point, I didn't know what their symptoms were. How are they feeling? What are they going through at this time? I didn't know. All I know is they got sick, they went home. So I didn't know anybody's stories is what I mean.
Oh, okay.
I didn't know, I had not had spoken to anybody who could tell me I had COVID and this is what happened to me. I had COVID and this is my story. The girls that I knew from work were barely going through it, so I didn't know their stories. So for me, I'm like, okay, I only know what I've seen in the news. I only know the horror stories that I've heard of, but I've never spoken to anybody who has gone through COVID and had symptoms and come out of it. So I didn't know what to expect.
Yes. Thank you for clearing that up for me, Ms. Campos. Can you share with me if you or any of your family members at your household are at risk?
Yes, I do have my parents who are high risk. My father is 74 years old. He has COPD, which is a pulmonary disorder, and he has high blood pressure, and he has a heart condition, which is called AFib. So all of those put him at high risk. Also, my mother recently had breast cancer. She had radiation treatments, which put her at high risk because her immune system is compromised due to the radiation treatments that she had, as well as myself with the high blood pressure.
So considering that your family is of high risk, how did they react to being positive to COVID-19? Did they get tested as well?
They did get tested. As soon as my positive test result came in, we did find a clinic for them to go to, and they all got tested immediately, and thankfully they all came back negative.
How did you react when finding out that you were positive? Were you scared? Did you panic?
Once I got the official positive, I was terrified. I was so afraid of my family members getting sick. At that point, it wasn't even about myself anymore. I already had it. Like, I couldn't do anything about it. I already had it, and I had to just tough it out and do the best I could to take care of myself. What I feared was my parents or my daughter getting it. And my parents that are high risk, if they were to get sick or something were to happen to them because I gave them COVID, I don't know how I would handle that. And that was my biggest fear. Them getting sick and something happening to them because I gave them COVID. Like, how could I live with myself knowing that something happened to them because of me? And even if it was unintentional, that would be something that would have eaten up at me.
And your family, their results were negative, correct?
All of my family members that I live with, thankfully, yes, they did test negative.
Okay. So can you share with me the precautions that you and your family members took after learning that you have been positive?
Once I tested positive, we went into extreme quarantine. I think we did a pretty amazing job. The house that I live in, fortunately, has a different living area space that I was able to be in. The doors closed to that room. So I basically lived in my bedroom, this living space with closed doors, and my own bathroom. And I went from those three spaces. When I went from one room to the other, I had to wear my mask and basically don't talk to anybody and just wear my mask and walk quickly to get to the other room. Probably longer than I needed to be quarantined. Doctor told me I only needed to quarantine for 14 days because that's how long you are contagious. However, because of my parents being high risk, I was not comfortable with that, and I quarantined probably about for an entire month and living in only those 3 rooms, probably for about a month, just to be safe, to make sure that my family was safe.
So how was the distribution of food? How did they give you food? How did that work?
Everything was given to me on disposable utensils and plates. My my parents would prepare food for me and put on their mask and gloves and open the door, quickly give me my food, and then shut the door. If I got hungry, I would have to ask them to bring me something. there were times where everybody was taking a nap and I would be hungry, but I couldn't do anything about it. I couldn't leave my quarantine room. So I would text my daughter and I would tell her, hey, can you bring me water or can you bring me a snack? Because I couldn't leave the room and I was at their mercy to feed me whenever they had, whenever they were eating themselves, because I was not going to leave the room. I was not going to take a chance to get anybody sick. So I had a trash bag in my room, and whenever I would eat, I would finish my food and then I would put it in the trash bag. And then at the end of the day, they would put their gloves on, their mask, and they would wrap up my trash and throw it out. So nothing that I was eating from or touching would go back into the house. Everything would go from my trash bag directly to an outside trash can.
So considering you were basically trapped in your room, how was that for you? Did you feel like you couldn't take it anymore?
It was really hard. I think I probably binge watched every show I could possibly find. I tried really hard to not get depressed, to not get angry. It was just a mix of emotions, because I was grateful that my family was not positive, that it was just me, but I was angry that it happened to me. I was confused as to why did it happen to me. I just tried to make the best of it and just know that the longer that I stayed quarantined, that was the best thing for my family. So put my own needs or my own boredom out of the picture and just keep in mind that the longer I stay here, the longer or the better it is that I can keep my family safe. So that's kind of what kept me going. It's like I was miserable, absolutely miserable, because I was bored, but I knew that that was my sacrifice to making sure that my family was going to be okay.
So can you please take me through the evolution of your sickness after you tested positive? For example, how badly did this virus attack your body?
I think that I was fortunate enough that it didn't get as bad as some people have gotten. However, I did have about 2 days of, I guess, the worst that I had it. The fatigue was just kind of nonstop, and I just kind of rested. But there was a day that my coughing got nonstop, and it was just nonstop coughing and coughing. And then I started to get the shortness of breath. And that's when I started to get scared. I had the feeling of taking a deep breath and not being able to get enough oxygen. And it's a very scary feeling. And I just felt like every time I would breathe in, like my lungs were not expanding enough. And the more that I thought about it, the more anxiety I got and the more paranoid I got. And then I would start to cough. And then the more I coughed, I couldn't breathe. And then it led to coughing and vomiting. And so at the end of that night, it was probably about midnight. And I was in my bathroom, on the floor of my bathroom, coughing and vomiting and gasping for air. And I was just terrified. But I tried to just kind of not play it off, but just relax and breathe. You'll be fine. And I just tried to go to sleep. But I was afraid to go to sleep because I couldn't breathe. And so I was afraid that if I would go to bed, I wouldn't wake up, that something would happen to my brain because I wasn't getting enough oxygen. Because that if your brain doesn't have enough oxygen, that's where there's damages that can be done and problems that happen. So I was afraid that if I fell asleep, I would be brain damaged, that I would have a stroke, or that I would die because I just didn't have enough oxygen. And I'm alone in bed, and who's gonna know? It's just me. My daughter's in another bedroom, but she's not gonna know if I stop breathing. So all of that anxiety, plus the coughing, plus the vomiting, plus the crying and gasping for air. My mom and my daughter were there with me, trying to calm me down, trying to figure out what do we do. And I just decided, I need to go to the emergency room. This is too scary for me.
So can you share with me your hospitalization experiences?
So that night that I had all of that going on, I went to the emergency room, and my mom and my daughter took me. I wanted to drive myself, and they refused to let me because they said, what if I passed out and crashed? So they went with me. Unfortunately, they weren't able to come inside, so they just left me at the emergency room, and I went in and checked myself in.
What hospital did you go to?
I went to Valley Baptist in Brownsville.
How long was your stay in the hospital?
I was there for about 5 to 6 hours only.
And what treatment did you receive?
The first thing that they did was check my oxygen level, and they gave me a steroid shot because I had a lot of inflammation in my lungs, which was what was causing my shortness of breath. And so weirdly, I was getting enough oxygen due to the oxygen reader they had on my finger. I was getting enough oxygen, but it was very hard for me. So once they gave me the steroid shot, it reduced the inflammation to my lungs, which allowed me to take deeper breaths. And so then that calmed down my heart rate, calmed down my blood pressure, because me not being able to breathe just elevated all of that.
So since, like you said, your daughter and your mom were unable to go into the hospital with you, what did they do? Did they stay in the parking lot, and were they there the entire time?
Yeah, I think we knew that most likely they would not have been able to come inside with me, but they didn't want me to drive, so they wanted to take me, and they didn't want to leave until I was done. And I told them, it's going to be a few hours. Just go home and I will call you when I'm done. And I think they might have just left to get coffee, something to keep them awake. It was about 12 or 1 in the morning when this happened. So I think once I got situated, they went to get coffee to keep them up and came back and sat in the parking lot. I kept texting them and talking to them throughout the night while I was in the back, but they didn't leave. I think they just left to get their coffee to make them stay awake the entire time, and they waited for me the 5 or 6 hours that I was there.
Wow. So what were the conditions of the COVID ward in the hospital? Were there other people with you?
I was not in the COVID ward because I was not admitted, but I was in the COVID waiting area. When I got there and I told them that I had COVID and these are my symptoms, immediately they took me to a outside waiting room. And basically it was a trailer, kind of like a construction trailer where you see the trailers that are outside a construction site. It was just a long trailer, and it was very bleak and gloomy and sad in there. And it was just myself and probably about 4 chairs, but there were no other patients. So I sat there by myself for a couple of hours till they were able to treat me.
So what did you see and hear while you were in the hospital, like in the waiting room or anything?
I wasn't in the waiting room for very long until they scooped me into the COVID trailer. I do remember seeing a gentleman that was laying in the parking lot outside. Now, I don't know what his situation was. At this time, a lot of people had family members in the hospital and you couldn't go and see them. So people were waiting for them. And this gentleman was just laying outside in the sidewalk. And he had his little mat that he was sleeping on. And I don't know his story, to be honest. And it kind of, I didn't know what to think. I'm looking out the window of this COVID trailer, and there's a gentleman in the parking lot sidewalk, and he's just laying there sleeping. Is he waiting for somebody? Is he waiting to be treated? That was a weird experience for me. But the actual COVID trailer was just honestly boring. It was just myself and the chairs for a few hours.
So how did they take care of you while being at the hospital? Did you tell them that you were positive with COVID-19? What precautions did they take?
I did. And the thing is that you can't really treat COVID. There's no treatment for it. Um, the precautions that they took was the standard, protective gear that they had. They had their gowns, they had their face masks, they had the shields and gloves. Um, but they had to, that's the only thing they had. I mean, it's the best protective treatment or clothing that they could have. And they gave me my steroid shot and my inhaler and, took my temperature and everything. But it was a very limited contact. I guess it was, obviously they had their distance from me other than when they were treating me. And there was no other patient in there except for one other patient who was probably a good 10 feet away from me. And I'm thinking that he possibly had COVID as well because we were in our own little isolated area, not with the other people.
So after being discharged, did you ever need to go back?
No, I did not, thankfully. Once I got discharged, they gave me a prescription for the inhaler. They gave me vitamins. They gave me an antibiotic and Tamiflu. They just kind of gave me a whole bunch of things that would not cure it, but to reduce the chances of me getting something like pneumonia.
So can you share with me if you have any health issues after having COVID-19?
I think the biggest thing for me is a little bit of the shortness of breath. I have noticed that sometimes I have to take a little bit of a deeper breath when I'm talking. I have a little bit of maybe paranoia and I feel like I'm not breathing enough. So I do constantly check my my oxygen level with the pulse oximeter that you put on your finger. When I start to feel, oh my God, I can't breathe, I put it on just to make sure. I can't run or walk as much as I used to because I get out of breath. That was one of the biggest things that I noticed. Right when I was getting over COVID, I noticed that even talking on the phone, if I started to talk a lot, I would get short-winded. If I would walk around a lot, I would get short-winded. So I think that kind of still lingers. And the doctor said that's the last thing to go. That's something that will linger with you for a while because there may be damages to your lungs. I did see a pulmonary doctor recently and I'm doing okay. So there hasn't been any permanent damages, but shortness of breath may come and go.
So what is the financial impact of having COVID? Did your insurance cover all of your healthcare costs? Did you have to pay for any treatments out of pocket?
I did. COVID, I mean, the insurance really only covered the initial swab testing, or rather any swab testing that I did, the insurance covered. But I had to pay for the initial antibody testing that I had when I first got tested. And then of course the emergency room, I had to pay for myself, or I'm still paying for.
So can you share with me a description of your job and your place of work before the COVID pandemic was brought by infected people to the RGV?
So my place of work is a place where we assist people who are looking for assistance with their taxes. We deal with a lot of elderly or low-income people, or really anybody who wants to have assistance to pay less for their taxes. We were receiving people in our office, probably between 50 to 100 people on a daily basis, just all day, nonstop, people coming into the office for all kinds of assistance with discounts or ownership changes or real estate evaluations. We had just nonstop people in and out of our office throughout the day.
So after the pandemic hit, how was your work life affected, considering that you guys deal with the public?
Well, the biggest change was that they closed our office to the public. we never shut down. We never stopped working. A lot of offices just shut down and didn't even go to work. We continued to keep our office open, but not to the public. So we were still available to help everybody, but not face to face. It was through telephone or through Zoom meetings.
So can you share the story of how you explained to your bosses or coworkers that you had contracted COVID-19?
Um, I had two coworkers that had gotten COVID one day before me, which is why I decided to get tested. So basically, I called my boss. I just said, well, I got tested. I didn't have my results right away, but I had to stay home. So when I finally got my results, I said, well, I'm positive. And they were like, yeah, we kind of figured you were. Based on my symptoms and everything that happened to me, it took so long to get those results, and everything happened to me before that.
So can you share with me how long you were out of work?
I was out of work for 5 weeks.
Were you first forced to work from home, or did they let you go on sick leave?
Unfortunately, at that time, we did not have the capability to work from home. So I was taking sick leave, and I was fortunate enough to have enough sick leave, or I thought I had enough sick leave to be out of work for a short period of time that I just took my sick leave.
So how long exactly were you out of work?
For 5 weeks.
So do you mind sharing with me the fear of not having enough sick leave? Were you scared that you were going to have to stay out longer? What did you do? Did you call anybody?
I did. At that time, I didn't know how much sick leave I had. I knew that I had a decent amount. But then when the 2 weeks turned into 3 weeks, into 4 weeks, I started to get worried. And I said, I don't know how much time I actually have. So I did have a meeting, or I called my boss, and I said, well, it's been 4 weeks already. What's going to happen when I run out of sick leave? I am in no position to be able to afford to not have a paycheck. I need my paycheck. So what do I do? And he told me not to worry about it. He told me that we would figure something out. We would figure it out with our board members, or we didn't know. I was the only person to this day in my office who has been out of work for 5 weeks. Even the other ladies who had COVID right before me were only out maybe 2 to 3 weeks. I've been the longest to be out for 5 weeks. And so he said, don't worry about it. When you get back, we will figure it out, but you will not go without one single paycheck.
So can you share with me if you were able to remain being paid while out with COVID-19?
Fortunately, when I was able to go back to work, I had enough sick leave to cover the entire time I was out. I was out for 5 weeks, and I had enough sick leave to cover those 5 weeks. So I didn't have to deal with let's figure out what we're going to do, because my sick leave paid for it all.
Did your doctor give you a medical clearance to go back to work?
Yes. Once I eventually tested negative, my boss did not allow me to come back to work until I tested negative. So when I did have the negative, my boss was able to give me the go ahead.
So you had mentioned earlier that you have taken multiple COVID tests. How many did you take?
I took my initial one plus 3 more.
And what were the reasons for the extra 3?
My boss would not let me come back until I tested negative. So after the 2 weeks, I tested again, and I kept coming out positive, and then positive again and positive again. And I kept taking my test every week, hoping for a negative. And finally I got a negative after 3 more tests.
So once you got that negative, how did you feel when you were able to go back to work? Were you relieved?
I was relieved. But I was also a little bit anxious. I was just nervous to get back around people again, knowing what I had been through and knowing how easily you can get it. Like I said, when I got it, I thought I was being cautious. And especially if I thought that I got it at work, going back to work, I was like, I don't want to get it again. I don't want to bring it home. So I was happy to be back, but I had anxiety and I was nervous to just get back out being around people again.
How did you show proof to your boss that you were no longer positive?
I brought my negative test results from my doctor's office.
And what sort of precautions do county offices take to help slow the spread of COVID, considering that there have been about 3 employees that have tested positive?
For our staff, one of the things that they did is they started to give everybody a day off. They were trying to alleviate the number of people in the office. So they started giving everybody a day off. So instead of working 5 days a week, we were working 4 days a week. So they were staggering it. So there was less people in the office. They gave everybody hand sanitizer for their desk or workstation. They put hand sanitizers throughout the office, and they limited the number of people allowed in our break room and limited the number of people per table in our break room.
So how did your coworkers treat you once coming back to work after COVID-19? Did they treat you any different? Did they try to stay away even though that you were no longer positive?
They were actually really, really great. I was worried. I thought people would look at me and be like, oh, she had COVID, stay away from her. She might still have it, or just the stigma of having had it. But everybody was just very concerned about me. Everybody was glad that I was okay. Everybody wanted to hear my story. So they were all very supportive and just great coworkers to have. Nobody was at all worried about being around me.
So for these next set of questions, I'd like to talk to you about how you feel with the precautions that have been taken due to COVID-19. Because you are a survivor and because you are of high risk, I would like to hear how you feel with the precautions that have been implemented. So my first question is, are you satisfied with the local response to COVID-19 in Brownsville and Cameron County?
I think that Cameron County has done a really good job of within their means being able to implement policies and mandates to help take care of the people of Cameron County. So yes, I think that I am happy with the way Cameron County has handled things. I think that they're also limited. Sometimes the state won't allow them to put some of the restrictions that they might want to. So I honestly think that with what they can do, they've done a really good job, and it's just a matter of the people trying to take care of each other to make sure that we are all safe here in Cameron County.
So since you are mentioning the state, are you satisfied with the state response to COVID-19 led by Governor Abbott?
Yes and no, if that's an answer. I feel like some of the things that he has done have been very helpful to try to get ahead of the game and to try to beat the curve. But I feel like if maybe we had just waited a minute and not just jumped right back in. I understand the economy and everything, but I also feel like don't give the people so much freedom. Freedom's the wrong word, but just make it mandatory. People are not going to do things on their own unless you tell them that they need to wear a mask. And I think wearing a mask is probably one of the best things that people can do to help protect each other. And if you don't make it a mandate or you don't make it mandatory or required, then they're not going to do it on their own. And I just feel like they need to stress that more, and they need to keep the restrictions. They need to implement curfews. They need to keep the occupancy levels down. I feel like that could have been done a little better, but I also understand keeping the economy going as well.
So are you satisfied with the national response to COVID-19 that is being led by President Trump and his administration?
I don't think I really am. I feel like, you lead by example, and people will do what they see. And if they see our leaders and our administration not taking it seriously and not wearing a mask and not telling people that it's a real serious thing, then they're not going to take it seriously. I feel like if the administration had early on stressed how this is real, this is very dangerous, you need to take care of yourself, you need to shelter at home, you need to do all these things. If they had stressed how dangerous it really is, maybe the people would have taken it more seriously. I feel like the administration has been very loose about it. And because of that, people have not taken it as seriously as they should have. And until you've dealt with it, or you've known somebody who's dealt with it, or you've lost somebody, you're not going to take it that seriously because the administration of our country is not even taking it seriously.
So if you had the power to respond to COVID-19, what would you do differently, if anything?
I think that one of my biggest things is the mask mandate. I think everybody needs to wear a mask. I understand your right to assemble and all of these things that people want to do. That's fine, but wear a mask. All of these situations are the perfect opportunity for spreading this everywhere. All of these events where all these people are getting together without masks, all you're doing is allowing this virus to just spread and spread. So if everybody just put a mask on, you want to assemble, you want to have your big parties, you want to do all of this, that's fine. Wear a mask. But until people realize that a mask, even if it's not an N95, it can still help reduce the spreading of this virus.
This is a special year in our national democracy because it is a presidential voting year. Did you vote?
I did vote. I went and I voted in person here.
Did you notice or do anything different because of COVID-19?
The things that I noticed were just your usual or standard COVID-19 procedures. The hand sanitizing station as you were walking in, your social distancing between voters, and the opportunity to do curbside voting.
Was there a lot of people at the voting station?
I did early voting. So when I did early voting, there were not a lot of people. I was able to get in and out within 20 minutes. I don't know what the polls were like outside of early voting.
Is there anything else that you would like to share with me about your experiences with COVID-19 that I have not asked about?
I would like to hope that people take this COVID-19 seriously. And I understand people want to live their lives. I get it. I want to live my life and go out and do all these things. But for example, the holidays that are coming up, everybody wants to see their family. Now, I may not get to see my family because we're trying to make sure everybody's safe. But the way I see it is, what's one Thanksgiving or what's one Christmas? As long as next year we're all going to be together? Or would we rather have our holiday together now and something happened to somebody and then next year we're not all together? So people just think now. They don't think long term in the future. They're thinking, I want to go out now. I want to go to a restaurant. I want to go out to a bar. I mean, it's a couple of months, it's 1 year, but what's 1 year out of your life and still having your family members for the next couple of years? Like, people just don't understand that. And until it hits you, until it hits your family, until you lose a loved one, people are not going to understand how serious this is. And I wish there was a way to get that message across to a lot of people who just want to live their best life. And if I die, I die. But the thing is that you're not just affecting yourself, you're affecting lots of other people by spreading this disease.
Well, thank you, Ms. Campos, for sharing your stories and your experiences of a Latino in South Texas. Your stories are very important to us, and I thank you for joining this interview with me and sharing your experiences.
Well, thank you for having me.
Thank you.